Over the next few minutes, we're going to talk about big data and by extension, AI in medicine, and with particular emphasis about AI in spine. Here are my disclosures. I have no relevant disclosures. So when we think about big data and we think about AI, it's often overwhelming and it seems daunting, almost intimidating. And part of the reason why it feels that way is because over the last few years, we've created and captured and consumed data at an exponential rate. Especially over the last few years, the amount of data that we create and capture it doubles almost every 2 years. And the market has, of course, recognized that also. So the growth of big data in healthcare is the compound annual growth rate is almost 20%. And in the US, that's a $19 billion market. So it is not surprising to say that the investment thereon from big data into AI is 10x just over a span of the last 10 years. And so this is, everything that we do. And I would say healthcare is almost a few years behind what's happened in technology in the rest of the world. So anytime you go to Amazon, for example, that is big data. Somebody's analyzing your shopping preferences. Anytime you order a test, that's being analyzed. So this is AI, big data and AI are here to stay. And the reason why they're here to stay is what we've figured out what we've known actually is that what we don't see, we don't see. There's so much in medicine that we don't know of. And even for something like imaging, right? I'm a radiologist, and I can tell you there are the pixels on those images have a lot more information than than a human eye can capture. And this is where big data comes in. Excuse me. This is where big data comes in that if you look at the processing cycle, it includes things like electronic records, the radiomic options, raw data capture, even administrative and financial data. And that data is then stored and shared. It's only in the recent years that we've been able to do that. And more importantly than that, data is analyzed by statistics and artificial intelligence, if you will, to give us either diagnostic data, prescriptive data, prognostic data, even policy data, if you will. So looking at the same thing in a slightly different manner, like I said, you have EHR, you have public health records, you have clinical data. This kind of gets stored, and then because we have the capacity and the capability to analyze large volumes of data, we can then use that data to give us more holistic information. So as I said, I'm a radiologist, and I believe, at least for AI, imaging is a cornerstone of AI or of machine learning. And it could be as simple as just helping with your daily workflow with a process, as in something like this, where you can automate spinal segmentation, you can look for anatomical variations, and all of this is done within a few milliseconds by a computer. So you essentially are taking away time spent doing some of this manual work into an automated process. And that's where, for any of these things to actually happen, big data is needed to initially annotate and identify these pictures. Similar to that, and taking a step further, there are algorithms. This is one such algorithm that can reliably give you, within a few milliseconds, the height of the vertebral body, the height of the disc, whether there's any protrusion, the spinal canal diameter. Again, things which eventually can be done manually, but imagine the amount of time you would save by automating any of these functions. Now, this goes back. I don't think I've used the word Cobb's angle in over 25 years when I was at Nair as a medical student. But again, with patients with spinal deformities, understanding these angles is important to figure out what surgical procedure you're going to use, or what how you would correct it. Again, these are things that can be automated. So this is at the very at the very bare basic, if you will, is that a lot of big data is used just to automate some of the processes that are otherwise manually driven. So going on one step further is using big data and AI as a predictive model. Here's one such study that looked at recurrent lumbar disc herniation, and what they looked at multiple characteristics, and what they found was that the using artificial neural networks, the accuracy rate, the AUC for artificial neural networks was far higher than using logistic regression. And again, this was in patients that had, that were undergoing, that had surgery and or had herniation and were at high risk of a recurrence. So if you take this and you take this and multiply it, increase your data size, if you will. This was using the national database, and this looked at microdiscectomies also, and again used the national database to identify patients at a high risk of complications. And what they found using this large group of patients is that the artificial neural networks almost always outperformed, they definitely outperformed the ASA physical status classification, but also improved on logistic regression. And these were, the ANN network was better at identifying patients at risk of venous thromboembolism, wound complication and mortality. Again, things that you want to know in before you go in for a major surgery. So, taking one step, making these more predictive and prognostic. Now you take this and multiply it even more. John Ratliff is actually one of my colleagues at Stanford, and a fantastic neurosurgeon. And he used the administrative claims database to identify patients at risk of complications. Again, the biggest thing that people worry about a spine, at least from a patient perspective, they worry about after spine surgery is the risk of complications. And being able to give patients a well analyzed answer is always critical. It always helps the patient understand the risks versus benefits. And in this study, they used close to 300,000 patients. And similarly, they found a respectable AUC of 0.7 for predicting these occurrences of these adverse events. Now, in all of this, I would be the first one to say that we are not there 100%. We are still in sort of an infantile stage, or in the baby stage. But as we develop our algorithms and models, I believe that these resources will be of tremendous help to our patients to identify their risk stratification. And and talking about, as I said, understanding and identifying where we still need work to be done. This was a very interesting paper written just recently, just came out last year, but looked at, what are the things that we need to be careful about as physicians. And these include several things. Registries are, at the end of the day, retrospective. Registries have missing data, but more importantly, registries are not granular. They can't give us exact details about a procedure. One of the other things that's critical for us to remember is that there's a big difference between clinical significance and statistical significance. So not everything that's statistically significant is necessarily clinically important. And that's where the human brain is going to be needed to identify where to use machine learning algorithms, which algorithms to believe, and what data to believe. And so I would say that, it is something we do need to embrace big data, and we do need to embrace AI, but we also need to be cautious about what we, to what extent we embrace it to, or what we believe. Not all data is processed the same way. Now, I want to leave you with this one last story. For those of you who actually follow baseball, you may have heard of Moneyball. This is actually a major motion picture now with Brad Pitt. And the Oakland A's were, in the early 2000s, a small team. They didn't have a ton of money. Nowhere they definitely did not have money, the kind of money that the New York Yankees had or the Red Sox had. But in early 2000s, they decided that instead of paying really big dollars to like these star players, they were going to embrace analytics, and they embraced analytics to the core. They every little bit of data that they could gather, they gathered and analyzed it over and over again. And suffice it to say that the Oakland A's, after embracing this kind of data approach and analytics approach, became one of the most powerful teams in the U.S. history, one of the biggest comebacks, if you will. And so the point I'm trying to make is that there's so much information in data, and embracing that data and understanding it and understanding analytics will only help us do our job better. So with that, I thank you for your time, and appreciate your patience.